In this session, we will be covering the basics of nutrition to get you started. A calorie is a unit of energy that people get from food and drinks that they consume. Energy can be used by the body for physical activity and basic processes of life, such as breathing and keeping warm. The U.S. Department of Agriculture has established daily recommendations for Americans. For males, it is encouraged to get 2,500 calories a day to maintain weight. And for females, it is encouraged to get 2,000 calories a day to maintain weight. Of course, these numbers constantly change as our weight and nutrition status change, but this is a good starting point for those who are beginning a healthier nutrition journey. If you are looking for the appropriate caloric balance for yourself, many factors come into play like gender, age, physical activity, and other health indicators. Nutrition is the study of how food and drinks affect our bodies. It is a critical part of health and development. There are five major food groups. Those are vegetables, fruits, grains, dairy, and protein, all of which are composed of macronutrients, micronutrients, and water. Macronutrients are required by the body and provide the body with the main source of energy and calories. They are essential for the body to grow, repair, develop new tissues, and regulate life processes. There are three categories: carbohydrates, fats, and proteins. The balance of food groups you consume is important as it affects how satisfied you feel with your meals and whether or not you are getting all the nutrients that your body requires. Micronutrients are needed in extremely small amounts, but are important in normal functioning of the body. There are two categories: vitamins and minerals. Vitamins are essential for supporting normal metabolism, growth and development, and regulation of cell function. Minerals are necessary for function of enzymes in the body. There are two types of vitamins: fat soluble and water soluble. Water soluble vitamins are excreted throughout the day. However, fat soluble vitamins can be stored long term and may even reach toxic levels. This is why you need to speak to your doctor prior to taking any vitamins or supplements. Most of the vitamins and minerals that our body needs we can get from the foods that we consume if you eat a balanced diet. It is important to drink plenty of water, as we have discussed before. Just to put it into perspective, every day we lose about 8 to 12 cups of water through breathing, sweating, and using the bathroom. Our body depends on water to survive. Water maintains our body temperature, healthy skin, circulates electrolytes, and lubricates your joints. Though it does not provide energy, it is a nutrient needed in large amounts. It is recommended that men have a minimum of 80 ounces of water a day and women have a minimum of 60 ounces of water a day. Diabetes Association offers a simple method of meal planning that can help manage blood sugar. The ADA plate method focuses on eating more vegetables. The ADA plate method recommends that you fill half of your plate with non-starchy vegetables, such as spinach, carrots, and tomatoes. One serving amounts to 1 cup raw veggies, such as a salad greens, or half a cup cooked, such as broccoli. You can have as many non-starchy vegetables as you like, but make sure at least half of your plate is filled with them. Fill a quarter of your plate with a carbohydrate, such as brown rice, or a starchy vegetable, such as green peas, which are rich in vitamins, minerals, and fiber. Beans and lentils contain both starch and protein with good amounts of fiber. Fill the last quarter of your plate with a lean protein, such as tuna, lean pork, or chicken. This section includes meat and other protein sources, such as eggs and fish. Look for lean cuts of meat and low-fat cheeses. A quarter of the plate is equivalent to a 3 ounces cooked portion. Drink plenty of water with your meals or zero-calorie drinks. The ADA plate method does not mention dairy products, fruits, or fats, but you should also include a serving of fruit or dairy in your meals. One serving of dairy is 2/3 of a cup. One serving of fresh fruit is a half a cup. When considering what fruits to eat, prioritize those higher in fiber and lower in sugar, such as berries, pears, nectarines, and honeydew. For fats, include good fats such as nuts or avocados in small amounts. All fats are high in calories, that is why it is recommended to keep the portions small. Limit full fat, creamy salad dressings, butter, lard, margarine, and cream. Even if you have had the same eating patterns for years, it's not too late to make improvements. Here we have examples of red flags and green flags. Stay away from diet plans that exclude entire food groups like carbs or fats. We want to make sure that you avoid elimination diets. Focus more on patterns that concentrate on eating more fruits, whole grains, lean protein, and minimal sugar, as they help reduce your risk of diabetes, reduce your A1C, lower your triglycerides, or reduce their risk of cardiovascular events. Keep in mind that you should use the approach that works best for you or is recommended by your provider. We have reached the end of the session, so let's review some quick takeaways. Focus on getting a balanced diet. Remember that all food groups serve an important role. Drink plenty of water and practice the ADA plate method over the next 2 weeks. Don't forget to weigh yourself weekly and check your blood sugar levels daily. All flyers and session content are available to view in your program modules. Thanks for watching.